Hi everyone, my name is Loretta Bosing. I'm the founder of Unite for Safe Medications. I'm also the mother of a child whose life relies on medications every 12 hours. I am here today because I wanted to make a video, first of all, to say that I went to Oklahoma to speak on behalf of patients and in support of patient choice of pharmacy legislation. Oklahoma passed awesome legislation, went through the House, went through the Senate, bipartisan support. That means with both Democrats and Republicans. It looked promising, and then the governor vetoed it. So the reason why he vetoed it is because of pressures from lobbying groups such as PCMA. And PCMA was there the day that I spoke on behalf of legislation. PCMA, by the way, is the lobbyist for PBMs, or pharmacy benefit managers. You may be familiar with them as they manage pharmacy benefits. It's pretty simple. There's Express Scripts, CVS Caremark, OptumRx, that's the big three, all have merged with insurance companies, all own their own pharmacies that they force patients to. For example, like CVS Caremark has CVS Specialty and CVS Retail Pharmacy. So that's why they have, millions of dollars to lobby with, and I mean, they're billion-dollar corporations. PCMA made a statement, and I want you to hear it. Here it is.
I came on board to PCMA and trying to figure out the easiest way to address this subject. I came up with two rules. Does a piece of legislation increase health care of employees, or does it lower the cost of care? If a bill increases the cost of care, it's not good for patients. If it doesn't give patients access to quality health care, it's not good for patients. So anytime a piece of legislation is before you, just use those two simple solutions, those two questions. Does it increase patient health care, or does it increase the cost? And that will give you a better guise to determine how you should look at this legislation.
So, PCMA, I'm so glad that they had said that if it increases quality and lowers healthcare costs, that they would support legislation. So we know that patient choice of pharmacy could obviously save lives because the quality of their pharmacies on the Better Business Bureau Consumer Reports is 1-star rating. 1 star. And some of those I would give 0 stars if I could. And we know that if you read through those, look on their social media, there are people's lives literally at risk. Christmas is getting ready to come up. There's going to be many delays, happens every year, and some of those stories are horrifying. You're having to play like a risky game with your life when you're forced to mail order pharmacy. It's not regulated by the FDA, so our medications are not stored properly. That's where my advocacy started. It's hurting our local pharmacies. It's just a really bad deal. We need people to get vocal about these issues. But PCMA, I'm going to hold you to your words. You said you could support this legislation, and when it comes to, you said you could support legislation that lowers healthcare costs and improves quality. I've never seen any poor rated quality pharmacies other than yours. And I've never seen any other entity, such as PBMs, price gouging Medicaid systems by the millions. If you look throughout several different states in our nation, you have many reports of millions of dollars being siphoned out of our state's Medicaid systems, because what they'll do is, let's say you can use your local pharmacy, they may only reimburse that local pharmacy $10. They may tell the insurance company that they need reimbursed $90. And when I say they, I'm referring to the pharmacy benefit manager, OptumRx, Express Scripts, CVS Caremark. They may say, oh, you know what, it's $90. And then that way they get reimbursed, but then they'll keep $80 for themselves. And then you have a pharmacy over here that $10 isn't even paid for the cost of medication. So I just want to say, PCMA, I'm so glad that it sounds like you can support patient choice of legislation, because we want to lower healthcare costs and we want high quality pharmacies, high quality healthcare. Thank you.